Good day, class. In this video, we are going to study depression. Depression is a very common emotion disorder, mood disorder. The person may present as sadness or loss of interest. This is one of the emotion disorder, and apart from depression, such as anxiety or the emotion around menopause, all those diseases, you can refer to this session and see how we explain the etiology of depression or the anxiety. And then you can use the treatment in this session to assist. Depression, firstly, is related to the emotion related to the 脏腑 organs. The first one, liver, the stagnation. The stagnation is very important. It is one of the most important causes of depression or anxiety. Stagnation. But what can stagnate? Not only qi, although we say qi stagnation. Qi stagnation. But apart from qi stagnation, there also can be such as the blood stagnation, phlegm stagnation, food retention. The food retention, when the food stay there, also retain stagnation. The stagnation due to dampness, so due to fire, due to excessive heat, all may result in stagnation. So the stagnation is one of the most important causes of depression and anxiety. But further on, what causes the stagnation? There are 6 different categories: qi, blood, fire, dampness, food retention, phlegm. So these are the 6 possible causes of stagnation. The emotion, the dampness, apart from the liver, we also need to focus on the heart. The heart is the primary organ to dominate the 脏腑 organs, dominates the mind. That's why we say the spirit. That's the mind, the emotions. So apart from the specific organ, such as lung or liver, but don't forget about the heart. And very commonly, these 6 pathogens, they may affect each other. For instance, the qi and blood, they may affect each other. The qi, the commander of the blood is the carrier of the qi. So the qi stagnation may result in blood stagnation and results qi and blood stagnation. It can further result in bloodstasis, in phlegm. Food retention may result in a heat. The qi stagnation also may result in heat. So whenever we see a patient, we think from these different aspects. We also need to think about the multiple causes of the qi stagnation. Overthinking also will result in the consumption of blood, also results in stagnation. Stagnation may result in internal fire. Spleen stagnation, as the dysfunction of spleen, may result in dampness. After long-term diseases may result in deficiency. So excess after long-term may develop into deficiency. The treatment will focus on the stage of the situation. The main symptoms, the patient must have the chief complaint of depression or anxiety. So when you see a patient with anxiety, the chief complaint will be anxiety. And then you can explain different symptoms due to liver qi stagnation or fire You can have specific manifestations of these syndromes. Fire, the heat. You must have something yellow, something red tongue, yellow coating, yellow urine. At temper, it's related to the liver. Sometimes laughing, sometimes crying. This is the emotional disorder. Distending sensation, that's the stagnation, qi stagnation. Heart and spleen deficiency. After long term, the patient may present as a heart and spleen deficiency, especially the yin deficiency, spleen and heart yin deficiency. Spleen and heart qi deficiency, pale. Yin deficiency, red tongue, and thin coating or scanty coating. Feverish sensation in the palms and under the soles. It's a very typical symptom for yin deficiency with deficiency heat. The treatment principles regulate the activate the qi circulation, pumping the heart to the heart mind, clear the fire. If there's no fire, you're going to clear the specific pathogens that I have introduced. 6 pathogens. The fire, the qi, blood, food, dampness, and phlegm. 6 pathogens. To clear specific pathogens. Due to this liver qi stagnation, reducing technique. Yin deficiency, because of the deficiency heat, the deficiency fire, we will use acupuncture with the even manipulation technique. Deficiency, Moxibustion, reinforcing technique. Focus on the heart, 神门, pericardium, because the pericardium and the heart, the function are similar. The pericardium, we always treat the heart from the pericardium, because the pericardium is the boundary of the heart, the protection of the heart. So we can focus on the heart and pericardium, liver. Round 15, also the heart for the backstreet points of the heart. Level 3 for the circulation. Level 14 and level 3 for the qi stagnation. Level 3 and level 4. Level 3 and large intestine 4 to activate the qi circulation. And then for specific pathogens, you're going to add those points. So for depression, the main cause of depression is the dysfunction of the heart mind. Although the depression directly related to the liver, the stagnation, but don't forget about the chief commander, the heart mind or the heart spirit. So the main cause we're going to focus on is the heart mind. That's why in the prescription, we also start from the heart, from the pericardium. The pericardium 7 is the yuan source point of the pericardium. Heart 7 is the yuan source point of the heart. Yuan source point. The combination, the pericardium 6 is the luo connecting point of the pericardium. And then the backstreet point, liver 3 is the yuan source point of the liver. As you can see now, although we study so many different points of the body in our treatment, we always use these special points, either yuan source points, mu from mu points, back su points, or yuan luo points, yuan source points, or luo connecting points, and the meeting points. So these points are the important points that you need to understand, because you will use these points more in future. Other treatment technique. So auricular acupuncture, electrical stimulation. For depression, because this is a long-term disease, chronic diseases, you can use auricular acupuncture if you want to, because it may be convenient for the patient to stimulate by themselves. But we have to, although we introduce the treatments to depression, to anxiety, we need to understand this problem is not the physical disorder of the human body, it's the emotion, something in psychologically, in mind, the mental, in the mental level, the mental disorder. So apart from the treatment itself, the patient care is also very important. The way how you discuss to the patient, the way how you care about the patient is very important, because this kind of patient may be very sensitive to what you were saying. In the meantime, you also need to encourage the patient to exercise, to change their mind, to focus on something else. This may help to relieve the depression, especially as a long-term solution. But before you diagnose this patient as a depression, it is very important that you have to exclude some other diseases. Don't always blame this patient is mad. This patient is so annoying because this patient got anxiety, got depression. You don't like this patient. Before you have this feelings to the patient, you have to behave well to the patient, because sometimes you see this situation is not the patient's fault, it's not the patient's choices to be in this situation as depression, as anxiety. So you need to focus on the patient's care, to make them more comfortable, to make them to feel relaxed, don't put on stress. Apart from this functional disorder, mental disorder, we also need to exclude the possible diseases that may contribute to the depression. So in this situation, especially for long-term diseases, the patient is advised to have a health body check. This health body check can be such as a physical examination or some common examinations, such as some common blood test, to exclude some severe diseases or some potential diseases. Thank you for your attention.